see, they have a lot of indigent patients, Medicaid or no insurance. And COVID this fourth surge has really hit, independents and everybody very, very hard. We're having nurses quitting, it's been a really hard few weeks there. And like Monday, I usually see probably about 30 patients a day. I saw 60 patients. Probably about 80% COVID related. People are in the ER right now. They're unable to be transported to other hospitals. They're coming in with chest pain. We're a rural hospital. We don't have cardiology. We don't have a cath lab. And they're just sitting there.
Hospital in Independence.
It's a very tough time right now. And
Lisa, what age group are you seeing with COVID?
Vaccinated, 80% are unvaccinated, but we are seeing some breakthrough cases, mostly more elderly because the immune systems are down a little bit. So, being vaccinated is, I think, still the definitely way to go because the majority are unvaccinated. And it's going through their families. This Delta variant is very, virulent. And so I saw within the last 2 weeks, I saw 2 3-week-old babies that had 3 weeks old, barely, that had COVID. One had a fever. They weren't very sick, but I don't know what's going to happen. We see them and they go. So it's affecting everything. So again, I was so happy to be able to go to this when it occurred. I don't know if I could have taken the time off now. But anyway, we'll get started now. And you'll see in my presentation how COVID has affected our, this past visit. So last year we weren't able to go due to COVID. And we were seeing like 500 patients a day when I went my 2 previous visits. We'd have about probably 12 doctors, a much larger group. The group this time, I think we only had maybe 6 or 7 physicians, and I was included in one of the providers. And so we saw only about 140 patients a day. So that's a lot less patients we got to help there. So, our impact was a little, it was still there, thank goodness that we were there, but it's definitely smaller. I'm sure the surgical groups are, operating on less people because you have to have they had to stand 6 feet apart from each other. They all had to wear masks. And I'll go through some of the guidelines that the government made sure we followed that allowed us to go back this year. And what Faith and Practice does is they bring medical care to the poor people of Guatemala. And I'll kind of go through a little history of Faith and Practice. So their mission is to improve physical, spiritual, and economic conditions of the poor in Guatemala through surgical, medical, and dental mission trips and health-related educational programs. We usually had like a gynecology component to our previous trips and dental, but they had to cut those out because they were so invasive in people's mouths because of the spread of COVID this year. We weren't able to have those groups with us. In 1991, while the founder of Faith and Practice was Todd Collier, he was studying Spanish in Antigua. And I was speaking with Mr. Hinojosa. Antigua is a beautiful little town in Guatemala, and it's got cobblestone streets, and it's very quaint. A lot of tourists, that's where they get all their tourists, go to this place. They have really nice restaurants, and a lot of the people come from the other areas to sell their goods. I've kind of brought some of my the beautiful textiles there. They make the most gorgeous things. And so they come there to sell their wares and to make money for, their home group. So that's where and that's actually one of the top places in the world to learn Spanish is in Antigua. So he had gone there. He was a pastor in Houston. And he began volunteering at Los Obras, which is a small hospital, was at that time very small hospital, that had some, I think, Catholic brothers that they would help the poor and do some basic medical needs. And he went there and said, you don't have any surgical groups, how about we bring some from the United States? And they accepted and said that would be great. And so he returned to Houston and he organized the first surgical team to Antigua in 1993. And then from there, Faith and Practice grew. So several years, I don't know how many after that, it was just surgical teams would go in there and do the different surgeries that they didn't have, in Guatemala. They didn't have the medical training there. And then probably, I think about maybe 7 or 8 years ago, they ran out of patients, to do these surgeries on that were local to the Antigua area. So they developed these village groups, and that's what I was on. And so in the village groups, we went to, we go out maybe 4 or 5 hours from Antigua or Guatemala City, those areas, and we go to the small little villages. We set up a clinic for 4 days, and then what happens, we have a lot of local volunteers, and they find out the most needed people in those villages that need care. Again, you know, we were seeing 400 or 500 patients a day, so we were able to see quite a few people in those villages. And of course, they triaged them, so the sickest came in first. You know, people that couldn't walk, the much elderly, the frail, we would see first. But again, like I said, this year it was a little different because we had to cut almost, you know, a quarter of the patients. But we traveled this year to Santa Rosa was the name of the place we went. It was about a 4-hour bus ride from Antigua, and then we went there, and you'll see, next you'll see kind of the top picture. This is it was a community center. So we were working in schools before, but because of COVID, they had shut down all the schools, so we couldn't even use them at that time. So this was a big community center. It had just, you know, windows at the top. And then what we had to do is make our own clinic. So we set up, you know, partitions with, so this is where they would all wait to see us. This was a referral center up here. We had like a lab over here and a pharmacy over here where we filled their prescriptions. We were able to give them about 3 months worth of prescriptions. So behind here, we were able to have some privacy and evaluate each patient. And of course, here's me behind a partition. So when we talked to the people, we had to have that, you know, between us and them. Some of the other things, I was in a pediatric clinic, which I just loved. I requested this, and I got my request again this year, because last year I was or year before last. So this was my interpreter, the younger girl on my right up there, and then that was Dr. Diaz, they're both from Oregon area. So I worked with 2 doctors and an interpreter. We had strict COVID precautions, so what we had to do when we actually touched the patients, we had to wear our N95 mask, our gown, gloves, and a face shield. So as you can see, he's wearing that. So in a very hot, humid, 95 degree, like it is out here right now. So it was some long days, I'll tell you that. You know, we're trying to be really good about wearing it all, but by the end of the day, we're like, I can't do this, you know, just stay there, you know. So it got kind of, so you can see here, when we were behind the partition, we could just wear our mask only. I wore like a little thing over my head at times because I had bad hair days there, you know, 95 degrees. So you could see we would talk to them, and then we would have to put on the gown and then the face shield if we went around the partition to talk to the patients. And of course, they all wore their masks. So again, it was different this year because of all the PPE we had to wear. It was also very hot, and I got a nice picture. I think this is the radiologist putting on his PPE. So it was very constricting doing that. Again, when we went before, it was, you know, the smiling faces, and they love to hug you, and that's how they communicate. So it was a lot harder this year. I mean, we still got the smiling eyes and the kids, but you know, it was a little different, and I'm definitely looking forward to like it was before, that's for sure. So they had some cute masks, some of them. You can see they had like little glasses on theirs. So we saw various pediatric patients with acute medical needs and some chronic issues that would need surgery. Most of them were nourished and dehydrated. And each patient was given an anti-parasite medication due to all the contaminated drinking water. So they don't have fresh water there. They pollute, there's a lot of trash that goes everywhere. So they all have the, you know, turista, or the diarrhea and the vomiting. And that's why they're pretty, you know, dehydrated a lot of the time. So everybody, the family members and the patient themselves, all get a bendazole, which is interesting. I'll kind of just on a side note. So I've been asked, and of course I'm sure you know what this is, the dewormer. So I've been asked at Lolly Kim several times by some older gentlemen, well, can you give me that worm pill? It treats COVID. Can you get it for me?
That's ivermectin.
Yeah, the ivermectin, correct. And I was like, no, it's not clinically proven. I can't prescribe this for you. I said, you can probably go to your local feed and seed and get it, but you know. So anyway, it's just a little side note there about a dewormer and COVID. Okay. So I digress. So here's, of course, me evaluating a little boy that was pretty malnourished here. really, really great kids. Okay, this was just a funny picture. This is my counterpart there, Dr. Diaz, looking in his ear. He didn't quite like that.
No, get out of my ear.
Okay, so the other really great thing that Faith and Practice does is nutrition classes and just health, diabetes classes, hypertension classes. So almost every child that I saw, we had a little area, and I didn't get a picture of it, but they had a little education area. And they had a lady that developed a online iPad program. So they had an iPad that they could actually, and that was in Spanish for the kids, that was like cartoons and things like that about what to eat, what not to eat, because a lot of these families feed their children Coca-Cola, because Coke's down there now, because it's safe. Their kids aren't, getting sick from it, so they can have Coke and their children aren't having diarrhea and they're, but you should see their teeth. So they have really rotten teeth. So just about educating them about sugary things, that Coke is, we would say the Coke is Diablo, Coke is the devil. So anyway, just, because they would drink it. I mean, and this one lady had a bottle for a baby with Coke in it. So, I mean, it was just, but they had no idea, So there was these great educational classes. So I sent everybody over there, because we had such smaller groups this time, so they had some time to really educate. They spent about 30 minutes giving them education about diet, and of course, if I had family members that had diabetes or high blood pressure, they were able to learn about those as well. So that was great. This was the nutrition, so they had 2 medical students, and then the lady in the middle, her name's Mary. And she's been doing this for at least, I think, 15 or 20 years. She's been coming down and teaching education. She's phenomenal. So that's the radiologist. He's looking at some different, so it was interesting.